The anterior cruciate ligament is 3 centimeters of very strong ligament that attaches from the front of the tibia, which is the shin bone, and passes backwards and diagonally to attach onto the back of the femur, which is the thigh bone. Its main functions are to resist rotation of the knee, as well as forward sliding of the tibia on the femur. ACL injuries are commonly occur when during sudden twisting movements or sudden changes in directions, or with a contact injury, such as sports like football, rugby, netball and skiing. So you can imagine in those sports you're changing direction very quickly, and in rugby especially you're getting contacted often from the side, which can injure the ACL. The ACL, as I said, is a very strong ligament, and so rupturing it causes significant injury within the knee. So there'll be obviously immediate pain and swelling within the knee. Often patients hear a pop or a crunch as the actual ligament tears or detaches from the bone itself. Typically they're unable to play on in the sport that they're doing, and they may later on notice an inability to fully straighten the knee as the scar tissue blocks full extension of the knee. And the very typical sign a few weeks later on is giving way or collapsing of the knee, especially when changing direction. So the treatment options can be described as non-operative and operative treatment. So non-operative treatments take the form initially of ice packs and crutches. A hinged knee brace is often used to improve mobility. A really important factor in non-operative treatment is physiotherapy. So finding a really good physiotherapy who understands ACL injuries, and they can often get people back up on their feet and functioning to a very high level without surgery. And operative treatments are what I would do is what's called an anatomic ACL reconstruction, using hamstring tendons for high-risk patients who are at high risk of re-rupturing, and there is, which we can talk about later. Then I would also add in a procedure called a lateral extra-articular tenodesis. So not all ACL injuries need surgery. So minor tears or partial tears will tend to not produce many instability symptoms. It's important to get the help of a good physiotherapist to get back on track with your sport. Even some more significant ACL injuries may not need surgery as long as you stick to straight line activities such as walking and swimming and cycling. ACL surgery is normally a day surgery procedure under a general anaesthetic. It involves harvest of your medial hamstring tendons, the gracilis and semitendinosus, and doubling them up. They come out like thick strings. I'll double them up to make a bundle of 4, and they pass through small tunnels in the tibia and the femur, and they're firmly attached to both sides. After the operation, there's immediate stability from the surgery. You have a full range of movement, and it's important to get some physiotherapy after the procedure. The tunnel placements are anatomic, meaning that they're exactly in the same place as your original ACL was. If you want any further information about this surgery, please look at my Top Doctors profile site or go to my website, which is www.deo-orthopaedics.co.uk.